Hello and welcome to Psychological Insights. The word of the day is shame. Shame, it's an old-fashioned word, reminiscent of Pride and Prejudice's "Oh, how shameful," or Shakespeare's "for shame." But it's an emotion that everybody feels. Is it good? Is it bad? Who knows? Today we'll be speaking to Dr. Robert Hamm. He's a clinical psychologist in West Hartford Center. I'm Pat Kazakoff. You're watching Psychological Insights. Stay with me. So what exactly is shame?
Well, it's one of the many emotions that we humans have. And you're right, it's as old as mankind.
It's an old-fashioned word. I don't hear a lot of shame being mentioned. I hear a lot of guilt being mentioned.
Right, yeah. Yeah, I'm not sure exactly why that is. I think that it is somewhat antiquated. It has to do with how we see ourselves, it has to do with ourself. Maybe it has some, I don't know, not necessarily moral connection to it. Well, actually, it does, as guilt does.
So how does a person see themselves? Like what contributes to me? Why do I see myself the way I see myself?
Well, I think that the reason why all of us develop an identity is because we live in a community of other human beings. So other people are the sources. It starts with our parents, of course, how our parents treat us. We develop an identity by relating to our parents, identifying. This was Freud's inspiration for coming up with his famous Oedipus complex, a very important rite of passage in early development in order for an identity to develop in a child.
So how does that identity develop? Like, how do I know what I look like, besides looking in the mirror?
We have the capacity, and even at a neurological level, there's evidence to show that there is a neurological substrate. They're called mirror neurons. That mediate our abilities to imitate whoever we're imitating. So we know that we have capacity for empathy, most of us do. So presumably, no one knows for certain, young children develop an identity by projecting themselves identifying with, imitating people that are closest to them, caretakers, siblings. And from that, I sort of internalizing that. So the technical terms that the Freudians use are projection and internalization, from which we develop an identity. And this is, the source of shame, because shame has to do with our identity.
So are you telling me that basically I get my identity from the cues that you give me when you treat me? So if you treat me as if I was brilliant, I think I'm brilliant. Is that more or less?
Yes, and also by identifying those people that we associate with, we project ourselves supposedly into them. So those that we associate with, we also identify. So our parents, for example, when we're children, how we see them, we internalize that as well.
So where does the shame come in? How does the shame sort of fit into all that?
Well, shame is the negative side of internalization. It's when we feel that somehow that we are bad, we have fallen short of some ideal or expectation, then we suffer the discomfort of knowing that.
Well, how shameful is shameful? Like, do people come into your office and say to you, "Hello, I have shame"?
Well, as you said, I think that a lot of people don't really, it's not at the forefront of people's minds. And I'm not sure exactly why that is, that shame doesn't get the respect it deserves.
So when people come into you and you assess that they have a shame issue, what is their usual presentation to you?
Well, I don't think there's any one particular or typical, but often shame is something that's underneath. It doesn't come to the surface. A person is not necessarily aware of that. Often shame is at the subconscious level. So a person may have different kinds of behaviors or issues in life that manifest feelings of shame that's at a deeper level.
So what kind of behaviors would they have that would manifest shame to you?
Well, it could be different kinds of ways of manifesting.
And clearly, if they're coming in to see you, they're not feeling good. There's something wrong. They know there's something wrong.
I would say that in general, shame causes us to hide. If we don't feel good about ourselves, about something, we're going to try to mask it, aren't we? Otherwise, we feel embarrassment or even worse, a feeling of humiliation, feeling ostracized, something's wrong with us.
So
we don't want people to see that.
So what would be the behavior that would mask shame? Are there some particular behaviors that are typical in masking shame?
Well, in my blog, I talk about toxic shame. If a person has had a very difficult childhood, been mistreated in childhood, neglected, suffered from something called complex post-traumatic stress disorder, they're going to often they'll develop a persona, a mask, if you will, because they don't feel good about who they are. So often a person will present as very pleasant, could even appear very sociable, but it's a veneer, and it would be difficult to really discern whether it's a veneer or if it's real until you get to know a person better. So if you meet them at a party, for example, you'd say, well, he's a great guy, you know.
Pleasant, very pleasant.
Yeah, very easy to get along with, or it could be funny. So shame would cause one to put a mask on, so you really wouldn't know offhand the difference between someone who's genuinely friendly or someone who presents. And some people are very discerning. So when I was a kid, you may have seen this TV program. There's TV Land, Leave It to Beaver.
Yes, I remember.
Yeah. So there is an infamous character on Leave It to Beaver. His name was Eddie Haskell.
That's the brother.
No.
That's the friend.
The friend.
Okay, the friend.
The neighbor. And he was extremely polite. And Ward and June Cleaver, Beaver's parents, would respond with this very uneasy feeling that Eddie Haskell was so polite, to Beaver's parents. Parents suspected this. I remember Ward Cleaver would say after Eddie would leave, there's something just not quite right about that boy.
And that's what we're talking about.
That's the discerning, sort of intuitive response to what Freudians call the reaction formation. Someone who puts up a front that compensates for something underneath.
Does the person who's putting up the front, does he realize, is he conscious that this is a front?
Now, that's a very good question. I think that most people aren't aware of that. It's something that is very deep in our psyche.
So why are they coming in to see you? Here we have these very pleasant people who are very sociable and very engaging.
Yeah.
Why are they coming to see you?
A person doesn't come in to see me because of a character defect, not ordinarily. It's rare because they don't know that they have a character defect, most people. So a person who has shame, who does see me, usually it's for a different reason. They're having problems in their relation. They can't get close to people. They can't get along with people.
Are they conscious of that?
Oh, yeah, that
That
of course.
they know.
That would be a reason, for example, or a person is feeling depressed, doesn't know why, or a sense of anxiety, or has an addiction. All these are the kinds of manifestations. They can be manifestations of a host of different things, shame being just one of the possibilities, or it could be shame in combination with other issues.
How does one get over this toxic shame, we could call it?
Yeah, toxic shame, as I said, it often derives from our childhood. Things often prolonged exposure. So we all know about post-traumatic stress disorder. It is a reaction to some kind of traumatic or series of events that are very identifiable. With complex post-traumatic stress disorder, it's not so identifiable. So presumably, the trauma arose out of a prolonged exposure to abuse or neglect or some kind of traumatic experiences that are not identifiable, but they are manifest by various kinds of psychological symptoms. It's the feeling that arises from trauma is that something's wrong with me. If it's a child internalizes that trauma and believes that there's something defective about them, and they carry that inside themselves at an unconscious level. So it will manifest as low self-esteem and difficulties in establishing closeness in relationships, or a characterological kind of schizoid or withdrawn kind of lifestyle.
So then how does one, given that a lot of this stems from what you said, prolonged attachment, a prolonged attachment of abuse or neglect, so how does one get over this? Because this seems to be a little bit cemented inside of you.
That's
It's
right.
a wiring. That's what I'm hearing, that
Yeah.
you're wired to be like this because of your circumstances.
It is a wiring because we know now that the brain, especially when we're children, is very fluid and malleable. And so our experiences in early childhood have long-standing effects at a neurological level when our amygdala and parts of our limbic system of our brain are still forming. And how do you treat it?
Because the people are presenting to you, I assume, later in life. They're not presenting to you when they're 8. They're presenting to you when they're adults and they're having a problem, all the problems that you mentioned, having relationships, intimacy, they don't feel good, they're depressed. So how does one treat those people? What can you do to dissipate this feeling?
Well, when a person is in psychotherapy is what you're asking. That's what I do. I'm a psychotherapist.
Mm-hmm.
I will be able to identify in the course of my work with a patient what are the sources of their symptoms and problems in life. And if it appears that shame is an issue, then that's something that I bring to the surface for discussion, for us to work on that, for them to understand where these symptoms are coming from.
So once you understand where they're coming from,
Mm-hmm.
that doesn't necessarily translate into, I don't have them anymore.
No, of course
So then
not.
what are the techniques that you use that get rid of these symptoms? Besides, I assume that finding out where they come from is one of the techniques. So the person is conscious, this is where it happened from.
Right.
But what else can you do?
You're right. I mean, identifying enlightenment to our problems is necessary, but it's not sufficient in order for us to overcome our problems naturally. There are specific techniques, but by and large, it's bringing to awareness and helping a patient to understand that it's not something about them fundamentally, but rather it came from something that was not their fault. Often people blame themselves for things that have happened or things that do happen, by explaining to them, these are the sources, this is how it happened, and it wasn't your fault. You had no choice. So a child who was abused, often they internalize that abuse as meaning there's something defective about me that deserved that abuse. And that carries over into adulthood as low self-esteem.
And then, so that's one technique.
Well, what I want to say is then you help them to understand that no, it's not that they're defective, it's not that they're inferior or that they're a bad person. But they had no choice, and they had to survive in that situation because they were a child and they had caretakers that they relied on and trusted in, even though they shouldn't. But they had to in order to survive. So helping them to understand that it was an adaptation. And now that they carry that with them, they don't need any longer to carry those defenses.
And they don't have to use that adaptation anymore.
No, but it's not easy. I mean, bringing that to awareness doesn't translate, as you were saying, so easily into transformation. It takes time for them to change their perspective of themselves and to begin to trust again. So you have to bring this to awareness, help them to understand they're not at fault. So I mean, I have a patient, for example, who was sexually abused as a child, and it has brought in her, as an adult, a terrible sense of shame, because she knows that she's different. She did not have a typical childhood, and she feels a great deal of shame that she doesn't feel guilty towards her parents as they went on in life and passed away.
She doesn't feel guilty.
Guilty.
That
she doesn't feel. She feels guilty. She doesn't feel a sense of normal mourning for the loss of her parents as other people do, and didn't understand.
And it bothers her that she doesn't feel that normal mourning.
That's right. She feels different, alone, separate from the rest of the world, inferior, and guilty that she doesn't have these normal emotions and doesn't know how to navigate that with other people or internally. And I help her to understand that there's no reason to feel shame about not having these emotions. Her childhood was not proper and normal. She was mistreated and abused. It helps her to understand that her reactions are appropriate to her situation.
But that's a radical situation. Like, you're talking about sexual abuse as a young person. I mean, everybody knows that is no good. That is bad. But what about a person who has ostensibly the family is normal, the child is neglected, they're not interested in him, they don't like him, they don't want to have anything to do with him.
Yeah.
Those people, it's not as easy for them to see what was done to them, because ostensibly they have a normal upbringing.
Yeah, that's not normal.
That's not normal.
Children should be loved and should be given the attention and care. So if a child is neglected...
But the child doesn't know he's neglected because it's the only thing he knows. He has breakfast every day, he has lunch every day, there's dinner every day, just nobody's interested in them. It's quite subtle.
Yeah.
The only thing that child knows when he gets older is what he's doing now that results in no relationships, no intimacy, repeated marriages, children that have nothing to do with him or her.
Yes.
So how does one uncover that? Because the person doesn't come in and say to you, I was sexually abused, and they don't say, I was neglected.
Right. There's not every case as dramatic as sexual abuse, you're right. But the example you give, neglect, is sufficient to create trauma, a sense of, a low self-esteem. Sometimes, Pat, I cannot identify. We go through a person's history and nothing is identifiable, and we have to just accept that and just work with the symptoms themselves. But in many cases, in a history taking with a patient, I am able to see what the patient can't see as the sources for their difficulties, that what they thought was normal, or they might, many people as adults, they idealize. The patient I was just telling you about idealized her parents. She thought that that was the right, how she was treated was the right thing to do. And this is, children psychologically transform something bad in their parents into good because they have to believe that their parents are perfect in order to feel safe.
When is the normal time for them not to believe that the parents are perfect? Like, when do you start sort of doubting that your caregivers are perfect?
The normal time is adolescence. We all know about that, right? Any parent will know this.
What, that adolescence,
Right.
you're not so, you know the parents not so good.
Exactly. But for people who have been traumatized, often they never learn this. They put their parents on a pedestal, and presumably this is a defense against seeing all the things that they don't want to see, the feeling of shame, the feeling of having been abused or neglected, because it's internalized, and if they look at it, then they feel awful and shameful about themselves, that they feel that they deserved it, they must have deserved it. So by taking their parents off the pedestal, by confronting them with that, it confronts them with their own, what they're protecting themselves from feeling, a sense of shame. And this is often with narcissistic personality disorders. Ordinarily we think of narcissists as conceited people, but presumably narcissism comes from shame, but the shame that is deep inside our psyches and in the subconscious cannot be confronted. And so, as Freud's secondary narcissism was a term used to identify those cases when narcissistic personality arises out of a defense against facing the possibility that one is bad, that one could feel shame about oneself.
It's complicated.
Yeah, that's the nature of our field that I work in. So there are different kinds of ways that, shame is a good feeling. I think it's useful in society. It's an outgrowth of the fact that we live with other people. This is where identity comes from. It helps us to be reflective so that we can monitor our behaviors and try to correct ourselves. If we don't correct ourselves, we become narcissists.
We talked about all the bad things that happen with shame, but now you're talking about the good things that happen with shame.
Yeah, well, yeah. It's the title of this topic is the two faces of shame. It's a double-edged sword. A negative emotion isn't necessarily bad. It's unpleasant. Unpleasant emotions serve a purpose in our society, in the world community, in the human race. It serves to correct us just as much as guilt does, to make us better people, but it can also become problematic. So with toxic shame, there's an internalization that makes it difficult for us to love ourselves, to trust others. We put up a mask, we become withdrawn, or we are false in our interactions, develop difficulties with intimacy. On the other hand, if we don't look at ourselves honestly, we can develop character disorders such as antisocial personality disorder.
What is that one? That one I don't remember. Antisocial
Personality, or sociopathy, the sociopath, person who doesn't have sufficient empathy, or with narcissistic personality disorder, a person who has such difficulty in accepting shame is so anathema to them that if you confront them about anything that they do, criticize them, they become either defensive, vindictive, or they deflect and blame you instead.
Is that a good indicator of a person who has strong shame, that they easily attack you if you bring up anything that sort of criticizes them in any sort of way? Is that a good indicator?
Do you know any public figures who might manifest in that way?
I don't know if that's on our agenda
to
talk about.
No, do you know any public figures who might manifest in that way?
I don't know if that's on our agenda
to
talk about.
No, we won't go there.
But yes, I would say yes. I think the world would agree. There's a fair amount of antisocial behavior going on.
Yeah, I think that some people, most people with narcissistic personality disorder, they're people first, and so they manifest in different ways. But some people fit the textbook so well, it's almost like a caricature or a cartoon.
What part does shame have in shaming people? Like, is there some part of shame that's part of prejudice?
Yes, well, I'm glad you bring that up, because that's in my blog, Pat, that, shame has a good element to it. As I say, it has a good purpose, and that is to help us to be aware of ourselves so that we can correct ourselves, be better people. But in fact, many people feel shame even though they're not responsible for the things they feel ashamed about, such as a child that's been abused, they internalize it, that's toxic shame. But another example of when people feel shame even though they're not responsible and it's not useful and it's harmful is when we feel shame by association. So this is sort of like the proverbial scarlet letter, Hester Prynne. We feel that somehow we have been stigmatized, we've been identified as belonging to a certain group, that in some way is vilified, is ostracized, or has been scapegoated for whatever malevolent purposes it serves the society. And a person can internalize that and feel a sense of association, a sense of shame by association, even though they are not to blame, and there is no rational reason for them to feel shame. And this can be just as toxic as shame at a more personal level.
So those are the incidents where we hear that that people have been targeted, homosexual groups or lesbian groups, and then people like jump off bridges. You hear about young people jumping off bridges, killing themselves. That would be the extreme level, I would assume.
Oh yes, it can lead to a feeling of self-hatred and even suicide in some instances. You said, and we read sometimes in the news these tragedies. When you are ostracized or marginalized or identified in some way as to blame for other people's problems or as inferior, that can be devastating. So this is another source of shame that does need to be identified, and sometimes I see it in my patients, but it's more at a sociological level. It's something that has to be dealt with at a sociological level.
Sociological, political policies that don't target groups.
Exactly. So, toxic shame or dealing with character disorders, how do you address that? That is more in the psychotherapist through psychotherapy. But shame by association, this is more of a sociological phenomenon. And how we should deal with that is at a personal level, of course, to speak up when we find that someone is saying things in any way that vilifies other people unfairly, or at a more global level, to sign on with or participate in social action, social causes, for the sake of correcting these kinds of prejudices.
So it is a complex emotion. It's something that everybody feels on some level, but it's something to be explored. I'm Pat Kazakoff. You've been watching Psychological Insights with Dr. Robert Hamm. Thank you, Dr. Hamm.
Thank you, Pat.